My mother was always a fighter through her whole life.
When Rachel Carlson's mom was diagnosed with an aggressive form of lung cancer, she embarked on the fight of her life. Doctors launched her into chemo and radiation treatments simultaneously.
She was still so strong, and she tried to be fearless, even though we were all frightened for her the whole time. It was very difficult to watch her go through that.
Nearly twice as many women die of lung cancer as compared to breast cancer each year. There's a 17% survival rate for lung cancer, and it's over 90% for breast cancer. So we have a lot of work to do because most women aren't aware of this.
Nancy Torreson of A Breath of Hope Lung Foundation raises money for research, education, and support for families like Rachel's. She says what too few people know is that lung cancer can be detected far earlier with a simple test.
We have to get to the point where we're scanning people.
Go arms up above the head. Good.
And doing the preventative work that we need to do so that America's #1 cancer killer can have different results.
The test she's talking about is a CT lung screening.
The patient will lie on their back and they will hold their breath, and the scan will last on the order of approximately 30 seconds.
CDI radiologist Dr. James Sullivan explains that in under 1 minute, the low-dose CT captures images of your lungs that can help catch cancer much sooner.
The CAT scan allows us to see in high detail all the anatomy of the lung, and what we're able to detect is very, very small lung nodules that are potential early cancers that are identified at a very treatable stage.
Medicare and Medicaid, along with most commercial insurance companies, now cover the scan. For people between the ages of 55 and 80 who have either smoked or have quit but have a history of a pack a day for 30 years or 2 packs a day for 15. You also may be eligible if you've been exposed to environmental hazards like asbestos. If that's you, recommendations are that you should get a CT lung screening once a year.
We want them to go in and ask their doctor for a low-dose CT scan. We don't want them to wait until they get referred out or misdiagnosed for months, which is what leads to the stat right now that most people in our country are getting diagnosed with lung cancer in stages 3 and 4.
Almost 5 years after her diagnosis, Rachel's mom lost her battle. Each year, Rachel holds a memorial vigil, hoping to spread the word about the test her mom never got to have.
I think that is the hardest part, is that she didn't have an option. Lung cancer took her life regardless of how much she fought to survive.